Hi, I'm Dave Wurzel, and you're watching PHTV for Living Well. And on Living Well, we look at a variety of topics related to living a healthy lifestyle. Today, we're going to do kind of a lightning cruise through taking care of our teeth. To do that with me here, we've got Dr. Brian Gamble of Gamble Dental. Doctor, thank you for being here.
Good morning.
We've talked about, you've been on the show before, we've talked about a variety of topics. Today, I'm going to pretend that we're not dealing with specific topics, like healthcare, like cavities or gingivitis. I want to talk about, I'm a consumer, I'm trying to take care of my mouth, or I'm going to the store, I'm going shopping, or how should I brush my teeth, or what should I use? Regular everyday issues for your patients or for me. And I'm going to take notes, and this is going to affect my dental care now, all right? Are you ready?
Yes.
Lightning round here. And if you need to explain, please do. I'm surprised this is a debate. I've heard it's a thing. Should I floss before or after I brush my teeth?
Okay, for most of my patients, the key is to floss, period.
Okay.
A lot of people, they'll think maybe it's a daily thing, it's a weekly thing. It's typically you should be flossing regularly, daily.
Okay. So whether or not brushing teeth, does it floss?
Just make sure you're flossing.
Okay. All right. As long as we're still on floss, this is a debate in my house. My wife likes one floss. I like a different kind. The two different kinds I'm talking about, like some are waxed or more textured.
Sure.
You got some that are glide or they're more the silky like.
Okay.
Is one better than the other?
One is not better than the other. I personally like wax just because I feel like it gets at things cleaner, but sometimes people have very tight contacts. There's a dexterity issue. So the glide is nice for that because it kind of slides through a little easier. So again, it comes back to use what you have.
Okay, floss.
Ease of use, yes.
Okay, whatever you can floss with, make sure you're flossing. How about this one? And again, I've heard different numbers on this. Brushing my teeth, in general, how much time should I spend, how long should it take me to brush my teeth?
I like 2 minutes. 2 minutes is, you can be very thorough at that point.
Okay.
Inside, outside, on one arch, and then on top, and then same thing on the other arch. But 2 minutes is nice. I think that's a real good number.
Okay, so that would be an interesting, I'm going to try it tonight, so I'll put on the timer. What does 2 minutes feel like? So instead of like I'm picturing kids, like racing through it, get it done in a...
2 minutes feels like the commercials between your favorite TV show.
Okay.
That's 2 minutes.
All right, I'm on that one. How about this? We're talking about brushing your teeth. Brushing, and I think for a long time, I brush sideways, up and down, maybe circular. Is there what's the right way to brush?
Better way, first of all, just use a soft brush. It's better for the tissue because you are cleaning the soft tissue as well. So the thing is, away from the tissue in a circular manner.
Okay.
Good approach.
Something like this?
Yes, kind of roll it a little bit.
Rolling it away from the tissue, circular, away from the gum lines.
Yes.
Right, okay. Soft toothbrush, okay. I want to ask about mouthwash. We've got, a lot of different kinds out there. Some have alcohol, some don't. Is there a better kind to use or not use?
Sure. I prefer the ones without alcohol, but Listerine is one of those that does have alcohol. Alcohol tends to dry out the mouth. So as we age, mouth is dry just to start. So that's where Listerine gets a little bit more funny using it.
Okay.
But I still think everything has its place, and the rinses are really important.
Okay. I want to ask, it's not on here, we're talking about the different types. So alcohol, maybe not, depending on the risk of drying your mouth. But some are, they're like just, I want to say, I don't know if mouthwash is the right word.
Breath deodorant.
Okay.
So something like Scope is a breath deodorant. That actually, it's a very temporary thing, feels good, but really probably doesn't have any effect on the tissue whatsoever.
Okay, I guess we're looking for fluoride then.
Yeah, we're looking for something that'll help the tissue. And then also, if you can get a fluoride rinse, that's a whole different animal.
Okay, all right. How about this? Brushing my teeth. Is once in the morning and once at night enough? Should I be trying to brush my teeth during the day after meals or snacks? How many times a day am I doing this?
Ideally after every meal, it'd be great to brush. But I always think just the most important time to brush is before you go to bed at night. Make sure you get everything clean off the teeth. So yes, during the day, very important, but the most critical time is before bed.
Okay, because you don't want
All that bacteria harbored on the teeth while you sleep.
through the night. Okay, all right, good tip there. And related, I didn't even know this was a thing, and then I heard about this. So I've just brushed my teeth. I'm getting ready to go to bed. Just brushed them. Should I rinse my mouth with water, just to kind of swish it around, get all that toothpaste out of there, or do I not rinse?
You can do it either way, but we've been encouraging patients lately, there's a fluoride component in the toothpaste, so a lot of times people have sensitivity. So having the toothpaste or the fluoride on the teeth longer or residual is a good thing. So usually we'll just say brush, spit out, and then that's it. Don't rinse out.
Okay.
I think it's helpful.
Okay. All right, good. So rinsing, if you cannot do it, that would be better.
Sure.
All right. Okay, we'll go that way. All right. Thank you. That was my line. I really appreciate it. That's a lot of great advice, very practical, usable stuff there. Any other advice you want to throw out there for people?
I think we're good there.
We're good.
Yeah, let's not
Brush
confuse.
brush after meals. Big one before you go to bed.
Flossing.
I'm going to sneak one more in on you.
Sure.
All right. Manual toothbrush, old school, the way I grew up like this, or the electric thing with the...
Love the electrics.
You like the electric?
Much more thorough.
Much more thorough.
Yes.
Okay. All right. I started me up, but I ended up getting electric. Yeah, I love it. It makes a difference for sure. All right. Thank you very much. A lot of good practical information
welcome.
there. Very good. Thank you for being here, Dr. Gamble.
Thank you.
I'm Dave Worsley. You've been watching PHTV4 Living Well, and we've been talking with Dr. Brian Gamble about dental care. Thank you for watching, and be healthy.